Can extrapulmonary TB be detected through blood tests? Have you ever wondered how doctors detect extrapulmonary tuberculosis? This condition affects parts of the body outside the lungs, like lymph nodes, bones, or even the central nervous system. Detecting it can be tricky because it often doesn't show clear symptoms and may not produce bacteria that can be easily found in sputum, which is the standard sample for diagnosing pulmonary tuberculosis. Blood tests can help in the detection of extrapulmonary tuberculosis, but they are not the sole method for diagnosis. One of the primary blood tests used is the Interferon-Gamma Release Assay, often called IGRA. This test measures how the immune system responds to specific tuberculosis antigens in the blood. While it can indicate if someone has a tuberculosis infection, it cannot tell if the infection is latent or active. Additionally, it does not specify where in the body the infection is located. So, while IGRA is useful, it cannot confirm extrapulmonary tuberculosis on its own. Another type of blood test is the molecular test, which includes nucleic acid amplification tests. These tests look for the DNA of Mycobacterium tuberculosis in various samples. However, their effectiveness in blood samples for detecting extrapulmonary tuberculosis is limited. This is mainly because the amount of bacteria in the blood is often very low. Researchers are also exploring other blood markers and immune signatures that could potentially help identify extrapulmonary tuberculosis. However, these methods are still in development and are not yet widely used in clinical settings. To accurately diagnose extrapulmonary tuberculosis, healthcare providers typically need to collect tissue or fluid samples from the affected area. This is because blood tests are generally used as additional tools rather than the main diagnostic method. A comprehensive diagnosis usually involves a combination of clinical evaluations, imaging studies, and microbiological cultures or molecular tests from specific sites, along with immunological tests like IGRA. In summary, while blood tests such as IGRA can support the diagnosis of tuberculosis, they cannot reliably detect extrapulmonary tuberculosis on their own. Confirming this condition usually requires targeted sampling from the affected area, along with clinical and radiological assessments. If you suspect you have extrapulmonary tuberculosis, it is essential to consult with healthcare professionals for a thorough evaluation and appropriate treatment plan.